So it's been so fascinating over my multiple decades of doing functional medicine, coming from the allopathic MD background that I did, because our training is very focused on drugs and surgery. And I love that training because it gives us a really good foundation for a differential diagnosis and figuring out that we're not missing anything serious. And granted, if any of us were in a car accident or had a heart attack or stroke, we'd still want the very best allopathic medicine. But over the years, what I've learned in my functional medicine training is that we now have so much more tools in our toolbox. And at the core, we're really just going back to the basics of medicine at the biochemistry and physiological level and understanding those pathways so that we can use things like nutrients to move those pathways or hormonal assessment to assess the whole pathway. And it's really just going back to, I always say it's just good medicine. Just an interesting story is years and years ago, I'd have colleagues think I was kind of crazy out there, with all the stuff that I did. And over the years, what has happened is as they have someone who's in their family suffering, or they themselves have not been able to find answers in conventional medicine, they're now calling me or calling a functional doctor they know and saying, is there something else we can do? Because all of us are more aware that the tools that we used to use are not as effective and we need to have a bigger toolbox. So I think not only with assessment of deeper testing, but more tools, including lifestyle, diet, exercise, sleep, all of these things are critical to optimizing our health.